So now we're going to talk about depression. All right, so depression, the causes are family history, early childhood trauma, postpartum depression is a type, socioeconomics, poor coping skills, unmarried later in life, medically ill. So these are just reasons why depression can happen. Some clinical manifestations, you're going to see, I just want to separate out that postpartum depression is more based on hormones, and that 70% of mothers experience the baby blues. So that's because of the drop of high, happy, and then that drop of low. All right, so the major depression disorder, being depressed mood is a minimum of 2 weeks, so 5 out of 8 is how many the patient has to have to be criteria of major depressive disorder, because to be sad just one day does not qualify. So they have an inability to concentrate or make decisions, psychomotor agitation and restlessness, like pacing back and forth, persistent thoughts of death and suicide, fatigue, being overly tired, overeating, undereating, binge, that varies how people react to stress, sleep disturbances, hopelessness, worthiness, and anhedonia, which is just saying the patient doesn't feel joy for anything they do. All right, so let's talk about some assessments there are out there, and then we can talk about the complications and the interventions. So mood and affect is a term used to, mood is a subjective internal emotional state, whereas affect is what other people see. They affect like what people see of you. Affect is objective expression and mood. It's appropriate, full range. It could be classified in different ways: appropriate, full range, stable, labile, blunted, flat, overreactive, depressed. So these are just ways to explain it. Some things you're going to see is you're going to want to monitor is, are they in a vegetative functioning, persistent mood disturbances? Are they performing, how are they functioning ADLs? Are they taking showers? Are they brushing their teeth? Or how are they taking care of themselves? Are they so depressed they can't walk out of bed? These are things to think about. Religious, spiritual beliefs. Are they spiritually distressed? You know, is there a change in their spiritual beliefs? Appropriate expression, judgment, communication patterns, sleep, nutrition, elimination, their physical activity. When things slow down internally and they feel depressed, also your body starts to slow down. So these are things to look for. Some diagnostics exams are out there. There's inflammatory biomarkers. High inflammatory with absence of an illness. This just tends to be the body's response. I think it's because of stress. These are just theories. Mental exam status. These are mental exam status is going to assess for the feelings, thinking, behavior, appearance, and perception of the patient. This is pretty common sense. Neurologic assessment, to rule out any other cause, because maybe they're fatigued for a different reason, maybe they're depressed because of an illness. Blood and urine you're going to check. A SAT assessment, a mood assessment are the ones that you probably should know, that are main, popular ones to know about. The locus of control really has to do with, a lot of times with depression, are they internally locus of control, or are they externally locus of control? People who are externally often experience more depression symptoms because they feel like they're out of control. The way they think, the way someone thinks, can also make them more at risk for depression. All right, so some interventions there are. Postpartum depression, let's just get that nicked down in the butt. They also can have antidepressants, anxiolytics, and electronic convulsive therapy. So just be mindful of that. Psychotherapy, though, for the postpartum depression mother is going to focus on the new responsibility of the role of being a mother, because just watch for suicidal ideation or homicidal of harming the baby. So if they have psychotic plans to harm the baby or themselves, emergency mood status may be needed to be used for this. So that's the main thing to think about when you think of postpartum. All right, so therapy, there's a lot of different therapies. There's cognitive behavioral therapy, interpersonal therapy, behavioral therapy, time-limited psychotherapy, group therapy. There's a lot of therapies. Help the patient question underlying assumptions, beliefs, and consider alternate explanations for problems. Overgeneralization, self-blame, mind reading. They think they can mind read. Oh, you don't like me. Negative and self-appraisal. So these are just therapies, a way of changing their thought process. Electroconvulsive therapy has actually had a negative connotation, like a stigma to it, but it's actually really helpful. It causes a seizure, memory loss for days, maybe around the treatment, but it may be repeated often 3 treatments, and it's highly effective. I went to last semester to a ECT, and the nurses even said, if I had depression, major depression, I would choose ECT over medications. Like that's what I've heard. Light therapy can also help. Light somehow makes people happier, and exercise, because it leaves that endorphins. There's other random ones out there just to know about: vagus nerve stimulation, cranial magnetic stimulation, deep brain stimulation. These are just to know about, but like they're not really testable. They're just like, these are other things that can happen besides ECT. All right, so things to be mindful of. The patient needs to adhere to treatment to make it happen. So the patient have discussion with the physician increases. The patient having a discussion with the physician or the nurse helps adherence for the patient, that you're giving them some sense of autonomy. That's really, 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 really important. In fact, I made it in yellow on my map. All right, so I'm going to talk about some of the medications to be aware of. So St. John wort is sometimes a medication that they use, and it's really important because that has a lot of contraindications. So just be aware that there's one St. John wort out there. But the main ones that are considered like antidepressants that are more like westernized type of medications are the SSRIs, which is selective serotonin reuptake inhibitor. I'm going to name off a few. The first line is citalopram, acetylopram, fluoxetine, and it increases serotonin levels because you're not letting it reuptake, so there's more serotonin available. The deal is that they're increased risk for withdrawal symptoms, so they can have general feeling of uneasiness, nausea, dizziness, lethargy, flu-like symptoms if they come off of it. So getting off and on is really, 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 really hard. Hold on. So I want to talk about some of the adverse effects. Adverse effects could be agitation, anxiety, sleep disturbances, tremors, sexual dysfunction. That's one of our exemplars. Tension, headache. Others are dry mouth, sweating, weight changes, mild nausea, and loose bowel movement. So just be aware of that. But the main thing I want you to take away is serotonin syndrome. It is highly lethal. So what is that going to look like? And that's really, really important for the nurse to monitor. If they know their patient's on an SSRI, they need to know what serotonin syndrome looks like in order to know when to call a healthcare provider and know what's going on. So hyperactivity or restlessness, tachycardia, cardiovascular shock, fever, hyperpyrexia, so high temperature, elevated blood pressure, elevated pressure and tachycardia, altered mental status, irrational mood swings, hostility, seizure, epileptic status, myoclonus, incoordination, tonic, rigidity, abdominal pain, diarrhea, bloating, apnea, and death. So basically, literally just everything is increased. So just be aware of that. All right. For interventions, you would remove offending agents, initiate symptomatic treatments. So serotonin receptor blockage with, there's a thing called cyprophethidine, methylsergide, and propanol. Propanol is to lower your heart rate. Cooling blankets to lower that temperature for hyperthermia. Cooling blankets, chlorpromazine for hypothermia, dantrolene, diazepam for the muscle rigidities and the rigors. So dantrolene and diazepam are muscle relaxants. MAOIs are I just want to talk about real quickly the contraindications because these are also risky medications. The main things I want you to think about is cerebrovascular disease. These are contraindicated to cerebrovascular disease, hypertension, congestive heart failure, liver disease, recurrent severe headaches, surgery in previous 10 to 14 days. You remember this is the 10 to 14 day one that you can't take with other drugs. Younger than 16, pregnancy, over-the-counter drugs, tricyclic, narcotics, antihypertensives, amine precursors, sedatives, general anesthetics, stimulants, tyramine. So this is the one where avocados, fermented beans, curd, fermented soybeans, soybean pasta, figs, bananas, meats, fermented, smoker or otherwise aged boiled meats, liver, fermented sausage, bologna, pepperoni, salamis, dried cured fish, and fish fermented. So remember to think about MAIs and the food. Okay. So what are you going to teach these patients? Emergency if he or she has a severe headache, blood pressure, monitor during the first 6 weeks, discontinue dietary and drug restrictions, maintain 10 to 14 days beyond treatment. So those dietary and drug restrictions are maintained for those contraindications 10 to 14 days even beyond. The typical adverse and toxic reactions to look for is adverse would be hypotension, sedation, weakness, fatigue, insomnia, changes in the cardiac rhythm, muscle cramps, anorgasmia, sexual impotence, urinary hesitancy, or constipation and weight gain. These are what to look for. Toxic is hypertensive, crisis, severe headaches, tachycardia, palpitations, hypertension, nausea, and vomiting. So these are to look for. So it's interesting that it can adverse to hypertension, and then toxic, it could be also hypertensive. The tetracyclics are, it's to prevent uptake of norepinephrine and serotonin. So yeah, prevent uptake of norepinephrine and serotonin. The side effects are sedation, orthostatic hypotension, cardiac arrhythmia, anticholinergic effects like your sympathetic, dry mouth, constipation, urinary retention, blurred vision, and tachycardia. So that's your anticholinergic effects. Interactions, MAOIs, CNS depressants, the sympathomimetics, because they're trying to make you increase. So MAOIs, barbiturates, disulfiram, ultracontracectives, anticoagulants, and some antihypertensives, benzodiazepines, and alcohol. So that's things to think about. Contraindicated with myocardial infarction, narrow angle glaucoma, history of seizure, or pregnant woman. All right, so dry mouth, severe constipation, urinary retention, warrant immediate medical attention. Blurred vision, hypotension is a fall risk, cardiac toxicity, sedation, and withdrawal are dangerous. So these are just things to think about. So the main ones of medications that are used for depression are SSRIs, MAOIs, and tetracyclics. Just the main thing to think about when it comes to this concept is they have a high suicide risk. So make sure to ask if they have suicidal thoughts and if they have a plan. That's the main thing. There's a verbal and nonverbal contract can help avoid this, like get the patient to make a contract that they won't do harm to themselves. They may need one-to-one observation. If they're high risk, 10 to 15-minute checks when they're more stable. And for safety precautions, remove all objects that could be used as a weapon. So like razors, belts, medications, things to think about. They can overdose on drugs. So it really depends on their history to begin with. So the main thing to think about is just really focus on those medications and those side effects and adverse reactions. That's everything with depressive disorders, and happy studying. So yeah.